Good morning and thank you for being here today. My name is Mary Kane and I am here today to walk you through the analysis for this project, where a medical staffing agency needs to allocate personnel during the upcoming flu season. The medical staffing agency will provide temporary workers to hospitals and clinics nationwide. To allocate personnel efficiently, we will analyze the impact of the influenza virus on the population across the country. Before continuing, I would like to share with you our primary data sources. The U.S. Census Bureau, which provides population data, including location and demographics. CDC, the Centers for Disease Control and Prevention, and the official public record portal for death certificates. These sources offer tools with up-to-date information for the 50 states we are analyzing today. How are we measuring the impact? Through the count of the death certificates that include influenza as the cause or contributor of death, especially when complications like pneumonia develop. So we want to ensure that the right medical professionals are available where and when they are needed most. We want to prioritize those states with the highest count of influenza deaths. We will cover 4 critical topics. 1. Historical flu mortality trends in the USA. The analysis includes data from 2009 to 2017. We will allocate the distribution of those flu deaths geographically, and we will identify trends through time. 2. The most vulnerable population. Once we have identified geographically the flu death concentration areas, we want to know who is most susceptible to the virus. To avoid any bias, the population was analyzed in 10 years age groups. Should we focus on pregnant women and children or on the oldest population? We will answer to that question shortly. 3. High-risk states. How many flu fatalities were reported in each state per year? How many deaths are in the most vulnerable population? What professionals are in higher demand during the peak season? And what areas in the country are the most affected? All this will be reviewed in our topic number 3. Finally, number 4, seasonality. What months present the peak of the flu season? While viruses circulate year-round, there are usually a few months when deaths are triggered. The most common flu outbreaks occur during the fall and winter months. We will analyze the flu activity per state and the most recent trends. Let's take a closer look. Between 2009 and 2017, flu-related deaths in the U.S. averaged between 40,000 and 45,000 per year. This count comes from death certificates that list the influenza virus as a contributing factor. In this heat map, the states are color-coded by their annual flu death count. Red indicates the states with the highest death counts. Orange are those states with a medium-high death count, and those with the lowest count are yellow. Notice how the differences between years are minimal. Between 2009 and 2011, Pennsylvania is the only state that presented significant ups and downs. In 2014, we noticed a flu death increase on the east side of the country, adding Virginia, Tennessee, and Georgia to the second tier, or the orange states. We can say that the flu death count presents a stable trend. We can identify consistency in the death counts for California and New York. We show the highest numbers of flu deaths. Identifying the states with higher mortality opens a door with so many questions. What is the hospital capacity for a city like New York with more than 8 million residents? Or how many people use public transportation? What about preventative education and accessibility? Hmm? Or what state do you think that ranks third in flu deaths? According to our map, for 2017, Florida 3,365 and Texas with 3,214 flu deaths for the entire population. Now, who is the most vulnerable population? To help identify which parts of the population are most vulnerable, I used a line chart where we are visualizing flu-related deaths across 10-year age groups. Notice how the red line represents the deaths in the population 85 plus. There is consistency over the years, 2009, 10, 11, 12, 13, right? There is no dramatic changes with any of the age groups. The oldest population presents the highest flu-related death count. The following high-risk groups include people aged 75 to 84 and 65 to 74 years old. This highlights the vulnerability of the broader elderly population. We will refer to people 85 years and older as the most vulnerable population. You might be wondering, what about the children? Are there no deaths reported for children? Well, the truth is that CDC excludes data for groups with fewer than 10 cases. And the reason is to protect the patient's privacy. So, while this means that we have limited data for the youngest population, it's important to remember that they too remain at risk. We have the total number of flu-related deaths per state, and we have identified our most vulnerable population. Can we compare the population aged 85 years and older between states? To answer this question, I have used a pie chart and a tree map. The pie chart enables a comparison of the number of flu deaths between the population 85 years old and older and the population 84 years and younger. With the tree map below, we can identify the states with the highest mortality rate in the most vulnerable population. The higher the death count, the bigger the square. These squares are sorted from largest to smallest, which can guide staffing decisions to serve older adults. We can also filter by year and by state. Let's check, for example, Pennsylvania. And we are going to check only the more recent years. Let's check between 2015 and 2017 only. All right, if I click on the square for Pennsylvania with the data of only 2015 to 2007, my pie chart is going to reflect the percentage of flu deaths in people 85 years and older, which is almost equal to the flu death count in the rest of the population, which include all people 84 years and younger. Geographic risk classification. Using this combo map, we are visualizing the states with the highest total flu death counts and also the concentration of fatalities in people 85 years and older. Do you see a relationship between these two variables? The circle size and the color represent the number of flu deaths among the elderly. So this is flu deaths on people 85 years and older. For example, in California and in New York, there are large dark circles displayed, indicating significant clusters of mortality in that older population. The smaller circles suggest lower risk. So if we compare Colorado and Montana, which one do you think presents less flu deaths in people 85 years and older? You are correct. Montana with only 77 flu death counts. Colorado presents 272. Or what if we compare Alaska and Hawaii? Which one do you think has a higher mortality on the oldest population? According to the circles displayed, Hawaii presents a higher count with 326 flu deaths in people 85 years and older versus Alaska with only 60 people who died due to flu. We can also filter here the most recent years. We won't notice much difference. As I mentioned, mostly of the trends are flat. There are no dramatic changes. This visualization helps to identify the states with the highest need for medical staff support. One last question. When should we have the medical personnel ready to deploy? For that, we are going to evaluate the flu activity by month. We know that flu season typically runs between fall and winter, or between October and March. Let's see here, again, the most recent years. And we are going to select one state. Let's see, Texas. Texas is showing flu activity all year round. However, we can identify here a peak in December, January, February, again February and March. The top peak counts 6 deaths per month in that elderly population. If I check, for example, Iowa also presents a flu activity all year round with the peak in January with 4 deaths in 2015. And it has been lower during the past 2 years. It was a peak in February, it was a peak in March. And this is how we'll be able to see in what months there are higher reports of flu deaths. Notice how Indiana presents the peak in December, January, March, and even June. So there is activity all year round, but again, on the coldest months, or with the peak between December and March, that's where we are going to find the highest count of flu deaths. Each state presents its own triggers. It may be the weather, the population volume, overcrowded areas, internal vaccination policies, education, etc. In this bar chart, we visualized the monthly flu deaths by state and year. For example, the states reported flu deaths all year round and presented a peak in January. This allows us to forecast staffing needs by time and place. Conclusions. The flu mortality is concentrated in older populations, especially on people 65 years and older, with being the 85 years and older the most at risk. Certain states consistently experience higher death rates each season. This indicates a need to prioritize staffing in these areas of the country. Flu deaths peak between December and March. That's the other very clear idea that we learned with this analysis. And the next steps or recommendations utilize predictive modeling based on trends from recent years, as we were doing between 2015 and 2017, to forecast needs more accurately. We want to ensure that the right medical professionals are available where and when they are needed most. Classify states into high, medium, and low tiers for better resource planning. If possible, pre-deploy staff. We want to prioritize those states in high risk. If possible, we want to send medical staff starting in October. In additional data sources, including hospital admissions, emergency room visits, and vaccination rates. Coordinate directly with local medical facilities to confirm staffing gaps and tailor the support to allocate. Keep monitoring the flu activity in real time using updated CDC alerts and surveillance tools that I mentioned. They are fantastic. Now, to conclude, the flu deaths in the United States follow predictable trends related to age, geography, and seasonality. Understanding the challenges that each state faces during flu seasons can help coordinate the allocation of personnel where and when they are needed. I hope this information is of value to your management decision team. If you would like to explore the interactive board, review the raw data, or have any questions, please send an email to marykane.col99@gmail.com. I will be happy to share more information with you. Thank you for your time.